November 19th, 2020 is Stop the Pressure Day. This year is slightly different due to extra pressures caused by COVID. The tissue viability nurses here at Harrogate pledged to stop the pressure and reduce the harm to our patients in our care. As TVNs, we will work hard with our colleagues, patients, families and carers to educate on how to stop the pressure.
A pressure ulcer is localised damage to the skin and or underlying tissue. The most common areas to look out for are bony prominences. The damage can be present as intact skin or an open wound, and it may be painful. It can occur on anybody and at any age. The risk factors to consider are things like age, body build, skin condition or type, underlying medical conditions, sensory impairment, cognition, medication, malnutrition, dehydration, reduced mobility, immobility or poor posture.
The TVNs will continue to support the staff, educating them on the skin bundle surface, skin, keep patients moving, incontinence, moisture, hydration and nutrition.
We all need to react to red, so we're using this red ball to pass to our colleagues around the trust who are going to pledge to reduce harm to our patients by implementing these preventative measures.
On Farndale Ward, we pledge to check all our patients' skin within 6 hours of admission within the initial assessment.
On Littondale, we pledge that patients' pressure areas will be checked at least 3 times a day and once by an RM.
In Violent Short Stay Ward, we pledge to promote the use of red pillowcase to prompt the staff to offload bills for vulnerable patients.
In Knaresborough and Boroughbridge community care team, we pledge to perform regular skin inspections and will teach and delegate these to carers, families and patients to do in between visits and advise to ring the district nurses if any concerns.
On Jerville Ward, we pledge to keep our patients moving and regular repositioning.
As practice educators, we pledge to continue to educate nurses in pressure ulcer prevention.
In Harrogate South Community Care Team, we pledge to assess and monitor incontinence and moisture which may contribute to pressure damage and refer on to a specialist if required.
On Oakdale, we pledge to keep people moving, getting them out of bed and keeping them fit and active.
On Wensleydale, we pledge to complete the Purpose T risk assessment and management plans on admission, transfer and end deterioration.
On Rowan Rehab Unit, we pledge to continue to attend pressure ulcer training to keep up to date.
We on CAP Clinic pledge to identify all at-risk patients and ensure adequate pressure relief.
On Granbury Ward, we pledge to provide specialist pressure area relieving equipment such as mattresses and pillows.
On Nidderdale, we pledge to use appropriate equipment to prevent skin damage, such as slide sheets and offloading devices.
On Woodlands Ward, we pledge to ensure our pressure ulcer prevention paperwork is completed and up to date regularly.
In North Community Care Team, we pledge to identify those of high risk of pressure damage, provide education to patients and families, carers, and to prevent any deterioration.
On Harlow, we pledge to consider and monitor nutrition to ensure a healthy, balanced diet and refer on to specialists if required.
As community therapists, we pledge to carry out skin inspections on our patients and complete the pressure ulcer risk assessment.
On Trinity Ward, we pledge to continue to rehabilitate our patients and encourage them to keep moving and offload pressure regularly.
The podiatry team pledge to support HDFT colleagues in the community and in hospital to prevent pressure ulcers and improve patient experience and outcomes.
In Ripon Community Care Team, we pledge to educate our patients, families and carers to watch out for early indicators of pressure damage, such as redness, pain, discoloration and temperature.
I pledge as Deputy Chief Nurse to continue to appreciate our wonderful colleagues and say thank you for all the hard work they do in preventing harm to our patients.
We want to thank everybody for their pledges. We all need to continue working together to reduce risk, keep our patients safe and harm-free.